So with PRI, we have an assessment protocol, tests that we use as objective testing. What is the position, for instance, of a femur in relationship to a pelvis? We use a test called a modified Ober's test, for instance, that will determine the position of the pelvis and actually help us through other testing. The patient that comes and sees us, doesn't matter what profession we have, for instance, what phase of gait, stance, or swing do they typically shift to? Is it the right or the left side? So that's one assessment, for instance, for the pelvis. We will do other assessments for the cervical spine, for the thorax, for the humerus in relationship to the scapula, all determining what side that we love or prefer to lateralize to and to rotate from. And so these patterns, which I will describe, start with, for instance, neurologic asymmetries. Our brain shares some, common functions, but there are also differences and strengths and weaknesses in our brain, as well as we've got asymmetries throughout our entire anatomy. So knowing that we have these asymmetries, that asymmetries are really a gift. And the reason they're a gift is because being asymmetrical, it helps us choose which side to go to and initiate movement. That's really important. But then if we become, as we assess objectively a PRI, dominant to one side or over-lateralized, which I'll show you pictures of, then that can cause a problem over time. So our first goal is to assess what's the position of a human body based on tests that we use in PRI. Once we assess that individual, then what technique can we teach that patient to find and feel a new place to go in their body, teach them a new skill to where they can shift from one side to the other. There's nothing wrong being on one side of your body, but if you become over-reliant, for instance, on end ranges, then that can cause wear and tear. So you can have patients with knee, hip, groin pain, sacroiliac pain, shoulder, neck, face, TMJ, and all that can be traced, for instance, oftentimes to the position of a pelvis. What side do we really prefer to be on?